So what's at stake for the future of American healthcare? Well, I used to live in the United Kingdom for a long time, and I lived under a so-called single-payer system for healthcare, the National Health Service of the United Kingdom. And I can tell you there are a lot of great doctors who care about their patients. I was treated under the NHS. I know people close to me were treated by the NHS, and they care. They really want to do right by their patients. But unavoidably, the system, because of the controls and the way it's set up, unavoidably, it devalues human life. There are shortages, there are rationing. All of these are inevitable. And the consequence is that you've heard about these stories, and I've heard about these stories. People go to the waiting rooms, and they're left to wither. Sometimes they die in the waiting rooms. Sometimes people wait on waiting lists for operations that they desperately need, and they don't have the 6 to 10 months or however long it is that it'll be before their turn comes up in order to get the treatment that they need. And they would survive if they were able to live that long, but they simply don't. I remember growing up, there were cases of young kids who were really sick. And this made news fairly regularly. I remember a number of cases. What happened to these children is that they could not be treated under the NHS, whether for waiting list reasons, whether for the rationing and so forth. And where did they go? Where else? The United States. They were, if you think of it, healthcare refugees in a way. That's what's at stake for the future of American healthcare. Obamacare is a major step towards that kind of model. And this so-called single-payer model, which I think is the end game that we're facing here, that's a euphemism. This is a really abhorrent and ugly system, and we need to fight it. Now that the Obamacare ruling has been upheld, we need to fight on and fight on and fight on unremittingly. We need to repeal it. We need to scale back the whole apparatus and the whole layer upon layer of regulation that is now in place and that Obamacare will magnify over the years.